While some rain after a hot and a humid day can be refreshing, the fact cannot be denied that it could bring in some monsoon illnesses as well. Hi, I'm Dr. Lakshmi, and you're watching Yashoda Hospitals, the Health Talk session, where all your health-related queries are answered here. So let's discuss and know more about monsoon illnesses and, more importantly, its preventive measures. Joining our discussion today is Dr. B. Vijay Kumar, consultant physician from Yashoda Hospitals, Secunderabad. Welcome to the program, Doctor.
Hi.
So, Doctor, the monsoons are here, and also the monsoon-related illnesses are on the rise, leading to increased hospital admissions and visits. So why do you think that illnesses are on the rise during this season?
What happens from the exclusive dry heat in summer, the changes that happen in the early monsoon? Monsoon entails a wet, humid climate, which is very ideal for the growth of organisms. The opportunistic organisms that are there in the soil, the air, and other areas, they tend to multiply quite faster and they tend to infect much more in the wet, humid climate. And coming from a very dry heat to the wet, humid heat, the chances of contamination of food, air, water, and everything is more. That's why we see more illnesses in the early monsoon.
So how do you think that the monsoon season affects the overall health system and the immunity of a person, Doctor?
Yeah, before going to that, I'd like to specify three things. What are the things that are required for the infection? One is the agent which causes the infection, which can be viruses, bacteria, or some of the protozoal organisms. The second is the host. Host are we, especially children, elderly. And third is the environment. Environment is the one between the agent and the host. Agent, of course, as I've told you, these are opportunistic infections. Most of them are viruses, bacteria, and some of them are protozoal. And as we come to the hosts are three types. One, already they have some comorbid illnesses like diabetes, blood pressure, kidney disease, some other malignancies. These are more vulnerable. The other ones, they are normal, they do not have comorbid conditions, but they're not fit in the sense they do not take care of their health properly. A third one is called as the healthy host, who exercises regularly, who sleeps at least 7 to 8 hours a day, who takes adequate water, who regularly consumes things like vegetables, fruits, stays away from unhealthy snacks outside, does not eat too much of non-vegetarian. These are called as healthy host. In monsoon-related illnesses, unfortunately, all three categories are affected, but the healthy host has the capability to defend himself more, and the virulence of the infection in a healthy host is much less compared to an unfit host or those who have comorbid conditions. The third one, as we said, is the environment. In the environment, what happens in dry summer, most of the water resources get dried up and most of the animals and other things go deeper into the lake to take water, and then they contaminate the lake bed. Similarly, humans tend to throw all sorts of waste around. They also tend to accumulate in the land or in surrounding the lakes. So once the rains fall, all of them through rivulets go into the lake bed, and they entail a lot of contamination with not only bacteria, viruses, a lot of other things. So that's the reason why the contamination of the drinking water is the prime source of many of these illnesses.
So what are some common illnesses that we see are on rise, especially during this season, Doctor?
There are three types of illnesses in monsoon. One, of course, we'll take the waterborne illnesses first. The commonest waterborne illness, both in children, elderly, and those who have less immunity, is the acute gastroenteritis, predominantly viral, but can be bacterial also. They're present with a lot of vomitings and loose motions. The predominant problem with them during this time is dehydration, and because of dehydration, both kidney failure and other problems may occur. After gastroenteritis, the next most common waterborne illness can be hepatitis A and hepatitis E, which are also fecal-oral route transmission through contaminated water. Hepatitis A and E also are common waterborne illnesses. Other than this, then they have protozoal illness where they have dysentery, and the more important infections like cholera, typhoid. These are the common waterborne illnesses that can come. Other than waterborne illnesses, we have illnesses that are transmitted by air. The commonest ones are the influenza, and the children and elderly suffer the most. Other than influenza, you can also have respiratory viruses which can cause cough, breathlessness, pneumonias and other things. And in the air, you can also transmit some of the bacterial infections. Last but not the least is through contamination of your food, and your hands and other things are also in the marshy places because of wet, marshy surroundings. You can contract illnesses like leptospira or other things. The last one is vector-borne. Vector-borne is mainly through mosquitoes. Mosquitoes transmit quite a bit of infections. The commonest, of course, is malaria. Then you have dengue. Then you have chikungunya, and henceforth so many other diseases related to mosquitoes. So these are the 4 ways where you can get illnesses in monsoon.
So discussing about vector-borne illnesses, doctor, what are some symptoms that we all should know, and when do you think one should seek a physician's consultation immediately?
So vector-borne, as we said, mosquito-borne, commonest ones are malaria, and we see a lot of dengue and chikungunya. In malaria, fever, as we know, comes in cycles every 24 to 48 hours, and they have headache, body pains, and nausea. These are the usual symptoms. The malaria, there are 4 types, but 2 types are very common in India. One is by Plasmodium vivax, other is Plasmodium falciparum. Falciparum is the more toxic type of malaria where it can affect the liver, the kidney and the brain. So whenever the fever is not coming down second or third day, when the patient has decreased urine output, or when there's jaundice, or when there's breathlessness, or when the patient is not responding properly to your normal commands, then probably that is the time they should go immediately to the hospital and consult a doctor. As far as dengue is concerned, again, the patient will have the common symptoms like fever, but they may have headache, significant body pains, and also a diarrhea initially. Most of the dengue patients, usually the symptoms come down automatically over a period of time without much help. About 70 to 80% of them come down naturally. But some patients, this goes on. If the fever is continuous for more than 5 to 7 days, and then they notice some red spots on the hands, or which is called as dengue rash, or you can have some bloody spots in the tongue or in the lower limbs, or the patient may not respond properly to your routine questions, or is not eating, or if the patient has significant abdominal pain and vomitings, that means they are going to complications of dengue called as dengue shock syndrome. So these are the situations where they have to immediately rush to the hospital and consult a doctor. And chikungunya usually present with significant body pains. Initially they'll have same like fever, headache, regular viral illness symptoms. But even after the fever comes down, they have very high rate of significant joint pains. They're not able to move from the bed also. Although they do not have other complications associated with dengue like brain encephalitis or hepatitis, but these joint pains are a significant cause of concern. They need to visit a doctor when they increase. Or initially, like any other viral illness, good hydration, good bed rest, and for fever taking your routine paracetamol or Vijay should be sufficient. But in cases who go on to develop complications, they require additional care at the hospital.
So it's now time to bust few myths and know the facts. Taking the first one, Mosquito-related illnesses such as dengue or malaria cannot occur for the second time.
Well, the dengue fever, unfortunately, is caused by, it has 4 strains. If you get dengue illness because of one strain, you may not get the dengue illness with the same strain. But if you have a different strain, then you can get dengue again. The problem with the second infection is it's much more severe than the first one.
So do you think there is any blood group that puts an individual to more risk at developing this disease, doctor?
Yeah, definitely. So some of the blood groups attract the mosquitoes much more common, like the O positive group. But the complicated illnesses like dengue and chikungunya are much more common in the A positive blood group. The difference is not so enormous. Any blood group can be infected.
So doctor, apart from vaccine that you've mentioned, are there any specific measures that protects against these mosquito illnesses?
As we told, from when we come from summer to rainy season, there are a lot of small puddles, small pools of water, and because of summer, people tend to drink a lot of coconut water. That coconut shells are thrown around, and a lot of empty pots and or unused tires where a lot of collection of water is there. These are the common collecting points where mosquitoes tend to grow. If in your surroundings, if you prevent these sort of water pools around you, then the chances of mosquitoes being there are less. And from the municipal point of view, the lakes and surrounding areas where usually the common breeding points, sewage area collections, these should be taken care of so that mosquitoes do not have a soil to grow. The other measures is, again, being a healthy host, like having good amount of hydration, good exercise, good foods also improve your immunity, even for mosquito bites. And then prevention of mosquito bite inside the house by having mosquito nets and regular spraying of anti-mosquito measures might help. And if you're going out, then probably applying the mosquito screen and other things might help you from prevention of a mosquito bite. The mosquitoes causing dengue are usually daytime biting mosquitoes, early daytime, early evening. So workplaces also, you should be careful that you should not have mosquitoes lying around because that's the common area.
So before we wrap this episode, doctor, is there any message that you would like to share with the audience out there?
As we said, monsoon illnesses can occur in anybody, but those who take care of their health by having a regular exercise, eating good, well-balanced food and maintaining hydration, optimum sleep, they probably have much more resilience to having these infections, and even if they're infected, they can probably get away much faster. Second, as we said, preventive measures are very important. There are certain very good vaccines for prevention, for typhoid, for hepatitis A, for influenza viruses. For dengue, we don't have it yet, but probably we may have that. So in where vaccinations are available, it's always better to take vaccinations just before the onset of monsoon, especially during April or May. That will definitely prevent some of these dangerous illnesses. The third, as we said, control of your surroundings. Probably do not allow any water to hold or stand in unused utensils or pots or some of the areas which you have. Avoid marshy places, and especially if you go to places where there's a lot of mud or marshy or to the fields, wearing gumboots might help prevention of those infections. And these are some of the measures you can take to prevent these illnesses.
So staying healthy during monsoon season can be as simple as taking the right precautionary measures at the right time. So this brings us to the end of this episode, and hope this episode was informative, and don't forget to follow the precautionary measures. Until then, take care and stay healthy. Thank you.